Hello, my name is Dr. Stacy, and for this PCSO Bulletin issue, I will be doing a quick audio summary and a review of this case. Patient BN presented at the age of 12 years 3 months with a chief complaint regarding the protrusion of his maxillary anterior central incisors. So this patient also presented with a brachiocephalic facial type and a slight right mandibular asymmetry, a convex facial profile, slightly protrusive upper and lower lip, an acute nasolabial angle, presents with competent lips and with a deep labiomental fold, and then a average chin and nose projection. This patient presented with a bilateral anterior crossbite at the maxillary lateral incisors. Also presented with a minimal overbite, and upon clinical examination, about a 2 millimeter functional shift. He presented with the class 1 skeletal pattern and a bilateral end-on class 2 molar and canine relationship. This patient has severe dental crowding, about 7 millimeters in the maxilla, and moderate dental spacing, about 4 millimeters in the mandible, with blocked out maxillary lateral incisors. And that anterior vertical functional shift of about 2 millimeters was again recognized during the clinical exam of the patient, and it's important to note that a functional shift must be assumed whenever there's a crossbite present, either anterior or posterior, until that functional shift has been ruled out. We can see the initial models for this patient here. And the main finding here is that the patient's Bolton analysis did result in either maxillary excess or mandibular deficiency. The initial pano for this patient does display that the maxillary and mandibular third molars are present and developing, and we'll continue monitoring those. The sinuses appear to be within normal limits, and the condyles on both sides are within normal limits with no beaking present currently, and with adequate cortication on both sides as well. This slide shows the patient's lateral ceph with the corresponding pre-treatment cephalometric measurements. So the analysis does indicate that there's a skeletal class 1 pattern with the A and B of 1.2 degrees and a normodivergent growth pattern with SNMP of 33.7 degrees. The maxillary incisors do appear to be proclined with an upper 1 to SN of 113.3 degrees, and mandibular incisors are proclined with an IMPA of 109.7 degrees as well. And then both upper and lower lips are protrusive to the E-line with 1.2 millimeters and 3.2 millimeters respectively. So, how would you treat this malocclusion? So as far as treatment options, overall there were 6 treatment plans prepared and presented to the patient and the patient's family. The first treatment option is no treatment. The second option does involve extraction of the maxillary first premolars, so the upper 4s. We'll do leveling and lining, eliminating the functional shift, and a therapeutic diagnosis of the mandibular asymmetry in about 6 months. The third treatment plan regarded extracting the maxillary upper premolars, the upper 4s, and mandibular second premolars, the lower 5s, then utilizing maximum anchorage in the upper arch with either a cervical headgear, Nance appliance, or TADS. And then the fourth option still involved extracting the maxillary first premolars and performing IPR in the lower segment 5 to 5. And then the other 2 options did include using something like a pendulum appliance for anchorage and distalization of the maxillary first molars. And the final 6th option being using a functional appliance like a forceps or a class 2 elastics. Overall, the patient and parents were explained that those last 2 options were not great for this particular case due to the patient's high angle. So ultimately, the patient and the patient's family did choose the second treatment option of extracting the maxillary first premolars, leveling and lining, eliminating the functional shift, and then doing another therapeutic diagnosis of the asymmetry in about 6 months. So here we have the patient's post-treatment final records, And overall, the patient's chief concern was addressed and resulted in a favorable treatment outcome for this patient. The total treatment time for this case was 27 months. The final occlusion resulted in bilateral class 2 molar and bilateral class 1 canine relationships. The anterior crossbite was alleviated and proper upper and lower inclinations were achieved. These final records indicate that there was correction of the functional shift of the maxillary crowding, the mandibular spacing, and of the incisal display. There was an improved smile arc, improved dental midlines, and an overall facial harmony was achieved. So for more details about this case, please see the written bulletin regarding this case, and thank you very much.